Hi, it's Kristen here at UT Southwestern Medical Center. Thank you for joining us for our Facebook Live chat with Dr. Leslie Childs on voice care. We're going to be talking specifically about ways that you can protect your voice, take care of it, particularly among teachers and others that use their voice all the time, because you need to protect your best asset. So as I was talking about, Dr. Childs, she's an assistant professor of laryngology and she works in the Voice Care Center here at UT Southwestern. And before we get started, I want to say a special thank you to the American Choral Directors Association. We hope that lots of your members are here. Thank you for telling them about this chat. We hope you get a lot out of it. Don't forget, as we go along, make sure that you like the chat, you share it with your friends so that more people can see it, and you ask your question in the comments section of your Facebook feed. We'll take as many of them as we can get to during our about 30-minute chat. And we're going to go ahead and get started. So Dr. Childs, thank you for joining us today.
Thank you. I'm thrilled to be here.
We're glad to have you. So I guess to get us started, since we're talking a lot about teachers and others that use your voice, what is it about teaching specifically that is so hard on your voice?
That's a great question. Generally with teachers, the vocal demands are, I almost want to say, somewhat unrealistic. Simply because generally teachers are, they're teaching 6-7 classes or periods per day, and typically they have minimal voice rest breaks between classes.
Right.
And especially the teachers that are in elementary education, those particular students need, that age group, I should say, really requires constant redirecting. And so it's a lot of vocalizing that's required. And so there have actually been papers written about these populations of individuals, teachers specifically, and we know that they are at risk for developing voice disorders. Greater than 4 times actually more likely than the general public to develop voice disorders, classroom teachers. And music teachers specifically are greater than 8 times more likely. So it's definitely an at-risk group of individuals.
So it's not just teachers, though. I mean, there are, granted, we're talking specifically to teachers, but there are others that use their voice a lot and also have issues.
Absolutely. So professional voice users include preachers, attorneys, call center workers, and of course singers. Of
course. Well, that is good to know. So rest assured, if you are not a teacher, we hope to have lots of information for you too. Get started a little bit more. How do you know you have a voice problem? What are some things to consider?
Yeah, that's a good question. Probably the most common symptom that people experience is persistent hoarseness. And by hoarseness, what we mean by that is a change in the voice quality. And often that voice quality change would be a continuous thing for about 2 weeks or so. And at that point, we usually recommend an evaluation, a vocal cord, vocal fold exam, just to make sure that everything's okay.
So that was something that somebody had asked ahead of time. They were wondering, they'd heard the term vocal cord. What does that mean?
That's a great question. So our sound source is called the vocal fold, same thing as vocal cords. So we have 2 of them, and they have 3 different layers, and it's really specialized tissue. We don't have this sort of tissue anywhere else in our body, and it's meant to withstand vibrations upwards of hundreds of times per second. The vocal folds, when we produce sound, basically a column of air comes from the windpipe and forces the vocal folds to vibrate. And then the tissues up above the vocal folds, called the resonators and articulators, are what more or less individualize our sound. But that sound source, because it's vibrating several hundred times per second, is somewhat vulnerable to injury, especially when we're using our voice for several hours on end throughout the day.
Right, when you're teaching or trying a trial or something like that.
That's right.
Okay.
That's right.
Well, so with that in mind, we talked about vocal folds and what those are. In case somebody doesn't get anything else out of this chat, what is your number one tip for protecting and preserving your voice?
In terms of, especially since this talk is geared more towards the professional voice user population, teachers, singers, those folks, my number one tip would be pace yourself.
Okay.
So vocal pacing has a lot of merit. And what
Okay.
I mean by that, we have a rule in the field of laryngology. It's a 60-10 rule. For a normal, healthy larynx, one should be able to use their voice for 60 minutes,
Okay.
but then should have a 10-minute voice rest break following that 60 minutes of voice use.
Okay.
Now, that's for a normal, healthy larynx.
Right.
Most of the folks that we see in the voice center are injured in some way, and so that ratio obviously needs to be adjusted based on injury. But by pacing the voice, another analogy I like to use is, let's imagine you have $1 worth of voice use a day.
Okay.
And let's say you're in the middle of tech week, and so
Yep.
you know your musical opens next week, and every night this week you're going to be in your tech rehearsal. So that's a few hours of a lot of vocalizing. Well, you'll probably spend 80 cents of that dollar at that rehearsal,
Gotcha.
right, during tech week that day, which means for the rest of the day you only have 20 cents left.
Gotcha.
And so by pacing the voice, we can make sure we're not overdoing it and be
Okay.
mindful of that, what we call vocal dose,
Gotcha.
to preserve our one and only set of vocal folds.
Okay. I want to get. She followed up with another question. She says, "What motivated you to become a laryngologist?"
Oh, I like that one. So I'm a singer, and so I wanted to care for singers for a living. And so in my world, it's kind of the perfect marriage of my passion for singing and my wanting to care for those who are singers and professional voice users. So that's what inspired me.
All right, we've got another one coming in. Let's see. They say, "Are voice care problems," this is from Lori, "preventable?"
Absolutely.
You're not doomed to terrible voice.
Absolutely, yes. So, and I didn't mean to scare any of the members in the audience who happen to be teachers or elementary music teachers, for example, in that high-risk group. It doesn't mean that every single one of them are going to develop a voice disorder or a vocal injury. Absolutely, they're preventable. One of the things that we recommend for our teachers specifically is a personal amplification system.
Right. Okay.
Yes, and so in fact there's been literature to support that those teachers who use a personal amplification system or a hands-free microphone in the classroom, their vocal dose is decreased by about 40 to 50%.
Almost half.
Almost half.
Wow.
So often we have a handout that we distribute to our, especially our teacher patients,
Right.
that has different recommendations for various personal amplification systems because again, by decreasing that vocal dose we can work to prevent injury. There are lots of other things that we recommend to prevent injury. One of those is what's called vocal hygiene, which is kind of an umbrella term for how we care for our instrument. Hydration.
I was going to ask about water.
Yes, always important. When we think about those several hundred times per second that our vocal folds are vibrating, what we want is thin, watery secretions to help lubricate and help prevent damage. And so the best way we can have thin, watery secretions is by being hydrated systemically. And so we're sticklers about trying to stick to that 64 ounces of water a day, and those sorts of things.
So water, though, that's the best option, not 64 ounces of
Coffee.
sodas or coffee. Or...
Right. Absolutely.
Okay.
Absolutely.
Good to
We
know.
want to avoid the caffeine and those sorts of things that end up actually drying us out more than hydrating us.
Okay, so we've got another question comes in, and this is actually something that I was going to ask you, but it came in from a guest. It says, "I have seasonal allergies that sometimes affect my voice. Do you have any tips for dealing with allergies?"
That's a question that we get pretty frequently.
Yeah. Is it a question for an allergist, or is it something that comes
No. Well, usually the way I respond to questions about seasonal allergies, indirectly they can very much affect the vocal folds because that postnasal drip can serve to irritate the back of the throat.
Okay.
And some people with a lot of postnasal drip will end up clearing their throat, right? And that directly traumatizes the vocal fold tissues.
Okay.
So, absolutely, going to see an allergist is a great idea, getting allergy testing and those sorts of things. But generally, I recommend saltwater rinses for the nose. It's a nice natural way to kind of help cleanse the nose. But yes, in an indirect way, they can affect the vocal folds in a negative way.
Okay. So you mentioned earlier you were talking about, you know, the moisture in the liquids and keeping you hydrated. What about a humidifier? Would that assist in any way?
Absolutely. That's an example of an external way to hydrate. And so using a humidifier, I usually recommend the Cool Mist humidifiers.
Okay.
Another way to more directly hydrate the vocal folds is through either inhaling steam or using a nebulizer to inhale steam. And that really helps to augment what I hope all of you are doing with regards to your internal hydration, which is drinking lots and lots of water.
Okay, so the steam would be something like either a sauna, if you didn't have access to that, maybe just putting your head over a bowl with a towel.
That's the old-fashioned way. Yep, you can absolutely, boil a pot of water and tent a towel over your head and inhale it. But there actually are devices you can purchase.
Okay.
There's a nebulizing device, a few that we recommend, personal steam inhalers that we also recommend. So
a little fancier than what I was going with.
Exactly, but hey, the old-fashioned way works. So.
All right. So there you go. So when somebody's experiencing this, I mean, what exactly is hoarseness? I mean, how do you? What's happening there?
Great question. So a few different things could be happening. Oftentimes what hoarseness means is either the vocal folds are swollen, okay, and they're not vibrating the way they should, or there could be a growth. So there could be a polyp on the vocal folds. There could be a cyst on the vocal folds. There could be nodules on the vocal folds. Okay. And these are all examples of what we call phonotraumatic lesions or growths. So they're not cancerous growths, but they're related to wear and tear on those very, very delicate, specialized tissues that we call the vocal folds.
Gotcha. Well, we're gonna keep going. Thank you for all of the questions. We have about 15 minutes left, so keep them coming. I know we've got some great ones already. Another question came in it's from Jill. She says, how severe is the damage done from frequently clearing your throat?
So frequently clearing the throat can lead to irritation. More often it's at the back of the voice box, the back of the vocal cord area, but that can certainly affect the voice quality as well. Okay. And so oftentimes, you know, if we had to pick and choose between our phonotraumatic behaviors, when we're comparing throat clearing to, say, coughing, it's probably a better idea to cough once versus throat clearing 100 times. Not that we want everyone to become frequent coughers, but with throat clearing, basically what we're doing is we're moving the mucus, the thick secretions that we're perceiving, a little bit to the side, and eventually that will migrate back to the level of the vocal folds. Whereas hopefully with one more efficient cough, that mucus is more or less being ejected, not to get too gross or anything, but it's more or less being removed from the area of the larynx. And so oftentimes that's a little bit less traumatic, one cough versus 100 throat clears.
Okay, that's just drives you crazy when you're in a meeting.
Exactly. In fact, we see a cohort of patients who are chronic coughers and or chronic throat clearers. It's a pathologic phenomenon that we diagnose and treat. And one of the main ways that we treat that, I'll just briefly talk about this because it involves our voice therapists. And we have a fabulous team of voice therapists, and they do work with our chronic coughers and our chronic throat clearers on behavioral ways to reduce this pattern.
Oh, wow.
But more frequently and more relevant to our audience today, they work with those patients who have voice disorders to rehabilitate. Oftentimes with our teachers, what will happen is our voice therapists will more or less dissect their daily schedule and try and figure out ways to work in voice rest breaks and those sorts of things.
Okay.
Also, work with our professional voice users on being more efficient vocally and really optimizing the way that they're producing their sound. So we work in partnership with our voice therapists.
That's interesting.
Yeah.
So really great question, Jill. Thanks for asking. We've got another one here, and we talked about this a little bit, but I think it would be a good one to go back to. Are there any food or drinks that are best to avoid right before you're going to, teach a class, deliver a lecture, argue a case? I know we want to drink water. Are there?
Yes. I would say some people do experience more phlegm and mucus from milk products.
Okay.
It's a little bit of a wives' tale that it happens to everyone. It's more of an individual thing. So if you happen to notice that milk products make you a little bit more phlegmy, then that would be something to avoid.
Okay.
Obviously, drinking water is great, but just to kind of fill in the blanks there, it takes about 4 to 6 weeks for our bodies to become hydrated. So it's not like right before you teach you should drink a gallon. Right, it's not an instantaneous thing. Now, steaming would be therapeutic. If you wanted to steam right before you gave a presentation or something like that, that would have benefits kind of immediately. Yeah. If you are prone to reflux, that spicy foods and things like that maybe wouldn't be the best thing to eat right before doing a lot of public speaking or teaching or singing.
Okay, that's good to know. I may try that steam thing. All right, we have a question in here from Rudy. Thank you for joining us. I'm glad you could tune in, Rudy. He's wondering, what's a good way to optimize voice projection?
Voice projection?
Yes,
okay.
Voice projection.
Great question. And our voice therapists would be able to really kind of do much more hands-on, individualized work on projection in a healthy way. But it all boils down to breath support, right? Our power source. We want to be making sure that we're using an appropriate amount of air. Also, we can optimize our sound by basically placing it in what we call the mask, which is a forward focus that optimizes the resonance pattern.
Okay.
Not to get into too much acoustics, but basically our sound source is somewhat responsible for the way that our sound is produced, but our resonator tract is also a key player. And so by making sure that we are our muscle memory patterns aren't maladaptive when it comes to how we project our sound, that's something that's really important. It's hard to answer that kind of generally because everyone likely needs to tweak the way that they're doing it in a different way. If you're trying to project over long periods of time, if you're a coach or a teacher, use a personal amplification system because then we won't need to project so much.
Okay. As a follow-up, does standing help? It seems like it's easier to project if you're standing rather than sitting giving a presentation.
You are spot on, absolutely, because posture is all about the mechanics in terms, we are our instrument, and so we have to be mindful of every aspect of our musculoskeletal system when we're wanting to use that instrument.
Okay, we should have done this standing.
You're right.
Maybe for the next one.
That's right.
All right. So what happens as and this was a question that came in ahead of time that's not on here. What happens to your voice as you age? I know lots of teachers are teaching for 20, 30 years. Are there things they need to think about later in their career that maybe new teachers wouldn't have to as much?
Absolutely, absolutely. So there are physiologic changes to the vocal folds, to the sound source with aging. Especially in men, what happens to the vocal folds is over time they can become somewhat bowed or atrophic. That's kind of the medical term. And what that means is the muscle bulk that makes up the vocal folds can thin.
Okay.
And so as a result, the vocal folds become bowed, the voice becomes weaker. And again, this is more typical in men. The pitch will rise, so they end up with a softer voice, a higher pitched voice. So they need to work harder in order to produce sound. And fortunately, we have interventions that can help with that. Basically injecting fillers and placing what are called implants into the vocal folds to bulk them up.
Okay.
In women, sometimes the opposite happens with age, meaning the vocal folds can become more dense,
Oh.
and so the pitch will often drop a little bit, meaning it'll be a lower pitched sound. Although we have female patients who also struggle with the thinning of the tissue. But yes, I think it's important to be mindful of the fact that physiology does affect the voice over time. But the good news is there are interventions, and we often see people that are aging that are struggling with their voice more than they were in decades prior.
Gotcha. All right, let's come back to that in a second. I want to thank both Jill for all of her questions as well as the others that have commented. Keep them coming. We have about 9 minutes left. Related to that, so if somebody is struggling with their voice and they come to see you, what does voice therapy entail? Are they going to be here every day for months? Are they going to be here, once a week? How does it work?
I'm glad you asked. So voice therapy is typically one 45-minute session a week. Okay, and the average number of sessions, it varies, but 4 to 6 weeks is kind of the average. And most people when we start talking or introducing the idea of voice therapy, I get a funny look,
Yeah.
I pronounce my words just fine. Why do I need to work with a speech therapist or a speech pathologist? And so what I need to do in that situation is explain that actually less than 5% of speech therapists are voice therapists. And so our team has a special skill set specifically in caring for the voice. And so it's not at all about how our patients are pronouncing the words. It's all about how they're using their voice specifically.
Okay, that's good to know. I think you probably just made a lot of people a little more at ease there.
Yes. We talk about, if we think about professional voice users and singers, teachers, we are all vocal athletes, okay? And so when we injure ourselves, we can think of it like an orthopedic injury. So let's say you tore some cartilage in your knee, okay? Your orthopedic surgeon would send you likely to a physical therapist, right? That would be part of the protocol. And so sometimes what I'll say is, our voice therapists are like physical therapists for the voice, for the vocal cords.
Good to know. So we have a question in. This one's from Cody. Cody says, are there any vocal coaches in the DFW area that you would highly recommend that focus primarily on tone, pitch, and voice quality concerns related to voice therapy? Do you know? You met some?
Absolutely. And that's usually, we definitely are, we partner with quite a few voice teachers around the community. In fact, we've given talks at most of the music schools in North and Central Texas over the past several years. And so we have certain individuals with whom we partner very frequently. Often it'll be a more individual recommendation because our team will know that individual's voice and better be able to kind of pair or recommend a pairing of a voice teacher. But we have a great deal of talent in terms of voice teachers in the community. And
so are there any maybe associations that Cody could look for to look within their membership in the area?
Absolutely. There's a NATS, it's basically the National Association of Teachers of Singing. That they have a nice database. That would be one resource.
Sounds like a good place to start. So we've got another question from Rudy, and these are great, guys. We've got about 5 minutes left, so we're going to take as many as we can. This is an interesting question. Rudy asks, are certain languages harder on your voice than others? Like, I guess what he's saying is, does a Russian teacher or a German teacher struggle more?
That is a great question. So in terms of different languages harder on the voice, there are a couple of layers to that. One is in terms of speech patterns, absolutely. Some sounds are more guttural. For example, German is a much more guttural sort of language.
Singing, that would be different.
Right, exactly. And so in a sense, the sort of resonance pattern that's associated with these languages may or may not predispose someone to difficulties with the voice. So I think that's a great question, and I think there probably is some truth to it. I don't know that there's been a lot of literature written about it yet, but who knows? We may learn more. You know, when singing, for example, as a singer, when I sing Italian, in Italian, it's a lot easier to keep that forward focus than some other languages. So. Anyway, I think you're onto something with that question.
Yeah, really good question, Ruby. Thank you for asking. So we've got a couple more minutes. You know, obviously it is the season for colds and flus. You know, a lot of people are in and out of work. You know, they're coughing, they're sneezing. I mean, how does that affect your vocal cords? And is it better to just rest your voice?
Amen. Absolutely. So I always say that I would say the majority of my patients who come in with an injury, they said, you know, I say, when did this start? When did you first notice a change? 9 times out of 10, well, I was sick with an upper respiratory infection. I had a cold, but I needed to sing that concert. I needed to perform in that recital, or you know, and so I pushed through it.
Needed to teach that class.
That's right. Needed to teach that class, that seminar, and I pushed through. And so that would be probably my second point, most important point for today. If you're ill, if you're hoarse, if you're not feeling vocally 100%, the best thing you can do is rest vocally.
Yeah. I think that's really hard to do, but that's good to know.
It is hard to do. You're right.
So one of the last questions we have, and it was one that our intern suggested, and she was wondering the difference. Does it really hurt your voice to whisper?
That's a really good question. So there are a couple of different whisper techniques. One is more of a constricted whisper, which involves kind of tightening up your neck muscles like this, right? And that sort of tightening can really predispose you to a pattern of more chronic tightening that can affect the voice in a negative way.
Okay.
The problem is that's the whisper strategy that often can be heard the easiest.
Yeah.
The healthier way to whisper is an open throat whisper.
Okay.
Which is just whispering like this. You basically can't hear me at all, but I'm not engaging my neck muscles. Right? And so that's a healthier way to whisper.
Yeah, I don't see your neck muscles tightening.
Exactly. But it's not as audible. And so when we recommend voice rest for our patients, we usually say no whispering.
Okay.
Because we're worried that constricted whisper pattern may take over and then again kind of morph into a more chronic muscle memory pattern that's not helpful or efficient.
Okay. All right. Well, there you go, Andy. We had it straight from the source. So thank you for answering that. All right. So I think, you know, we have one comment here that I'm going to read to you and I think we're going to wrap it up. It's from Jill. She says, Dr. Childs, Amy Hamilton, and the full team at UT Southwestern are amazing. They saved my voice and kept me singing. Just love you guys. Keep up the awesome work.
Aw, well, thank you.
That's nice.
We are very fortunate. I am very fortunate to partner with an amazing team.
Yeah.
We're actually the biggest voice center in Texas, and we're proud of that fact. And we have a great team, and we love what we do. We're passionate about what we do, and so
I think that shows.
Yeah.
Obviously, you've got some fans.
Thank you for that.
So there we go. All right. So while we're wrapping up, I want to make sure that we thank the American Choral Directors Association for sharing this with your membership and for all of the teachers and other professionals who tuned in. We really appreciate it. But most importantly, I want to thank Dr. Childs for your time. It's been a really good chat.
Thank you. Thank you so much.
Absolutely. So we will be back in a couple weeks with a new topic. So stay tuned to our Facebook page for upcoming events. In the meantime, have a wonderful day. Thank you.